Hello dear students, now in this session we are going to talk about our scapular region. Scapular region, yes, over the scapula, yes. There is our articulation between the glenoid cavity of the scapula and our head of the humerus. That is our scapular region. Various important muscles are attached. We will look one by one, like our three-dimensional orientation. You can observe here. Can you observe this our upper limb part? Yes, here you can see our bone scapula. Scapula is having glenoid cavity which is articulating with the our head of humerus. So the muscles which are attached around this area, that is our scapular region, or you can say shoulder region. Fine. Now try to understand what are the different muscles which be visible here. Yes, when you will do dissection, then skin, superficial fascia, okay, deep fascia, this all will be visible. But here at this shoulder part, there is the first muscle which is triangular or delta shaped. This is our deltoid muscle. This is our deltoid muscle, delta shaped muscle. Fine, sir. Then we are doing dissection. So try to understand. Here you can observe the spine of scapula. Just above the spine of scapula, the muscle will be known as supraspinatus. Supra means above, spinatus means just spine. So above the spine, muscle is located, supraspinatus muscle. Okay, and below the spine of scapula, there is our infraspinatus muscle. Getting the point? So this is our infraspinatus muscle. Fine, sir. Now try to understand. There is another muscle within the subscapular fossa. This is subscapularis. It is also located around our shoulder joint. Okay. So this is our subscapularis. Now try to understand another muscle. Can you see this muscle? This muscle is small and it is again going towards the our humerus, participating in area formation around the shoulder joint, scapular region part. So this is our teres, wide rounded muscle, small in formation. So this is teres minor. Okay, and also there is a teres major. But can you see the glenoid cavity is here, shoulder joint is here, but this muscle, this teres major, is not there. It is situated near the our bicipital groove. You know bicipital groove, lady between two major. Yes, it is the part of the lady between two major. So this is the teres major muscle, but it is not making, many times this question have been asked, teres major is not participating in formation of our scapular region. Okay, so this all the things we are going to read one by one. So try to understand. Yes. What you have to remember. We are going to talk about our scapular region. Yes, shoulder or scapular region. Yes, sir. Yes, it consists of structures, okay, which are around our shoulder joint. Okay, sir. Fine. Now try to understand what we have to look mainly in this area. Just like the other region, first we will talk about the our surface landmark. Yes, sir. So first we are going to look for the our surface landmark. This is the our definition. Second is our sorry, important surface landmarks. What are the important bony structures here? Because when you will be able to identify this structure at the shoulder area, only then you will be allowed to move the scalpel during the orthopedician surgery, joint surgery. Okay, that's why. So you can follow the textbook for your study purpose, taking this image. Look here. So you are looking the person from the back side. Can you observe the important landmark? You can feel on the back side there is the one horizontal running bony process, that is our spine of scapula 1. There is the large bony projection, that is our greater tubercle 2. Okay sir. Also you can feel the inferior angle of scapula on the back side, lower side. Yes, you will be able to feel the lateral epicondyle for the our arm elbow region. Also you can feel the medial epicondyle, just touch on the medial side of the arm. Whatever the most bony projection you are feeling, that is a medial epicondyle. And in the same way, lateral side, lateral epicondyle. Yes, we will see the head of the radius and olecranon process also later. One more point which we have to mention here, this particular bony point. The bony point which is most prominent at the top of the shoulder, touch the top of the shoulder. Okay sir, whatever the most bony prominent part you are feeling, not the clavicle. Okay, you can feel the clavicle easily. Okay, besides this clavicle is laterally articulating with acromion process. So you have to also mention this acromion process. Okay sir, so these are our different points, surface landmark. Okay sir, now we are looking for the our dissection. Okay, so just a few information. Dissection, when you will do dissection, first layer is visible, definitely that is skin. After the skin, definitely you will look the superficial fascia. After the superficial fascia, yes, you will see the deep fascia, and after the deep fascia you will see the muscles. Okay sir, so the muscles of scapular region will be visible. So try to understand what you have to remember. Yes, skin, no special feature, always the superficial fascia, it will have our subcutaneous fat as well as cutaneous nerve and vessels. Supraclavicular nerve, they all are located here. Deep fascia, yes, this deep fascia is thick. Also it provides, yes, gives numerous septa, and this deep fascia is also gives origin to muscles of scapular region. So it is participating in formation of the our muscles of scapular region also. Getting the point? Okay, so these are the our different points. Fine sir, so you can remember these things. Now try to understand what you have to remember. What are the different muscles? So you can remember the muscles. One triangular muscle, that is our delta shaped muscle, that's why you will say deltoid. One other muscles you can remember with the trick SITS. Yes, second muscle, third muscle, fourth muscle, and the fifth muscle. S for the muscle above the spine, so what you will say, supra spinatus. below the spine. So what you will say, infra spinatus. Yes, another muscle is large rounded muscle. That's why what term you will use, teres. And this is a small, that's why minor. Remember, major is not included in this area. Another is our sub scapularis, because it is located within our subscapular fossa. Getting the point? So these are the our different muscles. What you have to remember, the trick is SITS. SITS. Sits muscle are there. Fine. Okay. Okay, sir. Now try to understand the more facts. Yes. Yes. After this all, now we are going to look the each muscle one by one. First we are going to talk about our delta shape muscle, that is deltoid. Okay, so one by one we are going to look each and every muscle. Yes sir, first we are going to talk about our delta shape muscle, deltoid. Okay, fine sir. Whenever you are reading any muscle, you have to remember the origin, insertion, nerve supply, action. Okay, so we have to read the origin, insertion, nerve supply and action. Getting the point? Yes sir. Fine. Now see here, nomenclature. This deltoid muscle is named because it is delta shaped. Also you can say it is triangular. That's why. Yes. Origin, I will show you. It is having the three types of the fiber: anterior fiber, middle fiber and posterior fiber. Yes sir, we will see. Insertion, it is easy, that is situated within our deltoid tuberosity of the humerus. If you can recall your, yes, do you remember osteology part, deltoid tuberosity? So only one line you have to remember. Nerve supply, no excuse, only and only one nerve, that is our axillary nerve. Only the axillary nerve will supply, very important MCQ. And action, again we will see the action of the anterior fiber, middle fiber, posterior fiber, this all. So this is the summary. One by one, let's start our deltoid muscle. So for your study purpose, you can look this diagrammatic presentation and how we will make this diagram easier. Okay, so just looking for this all the things. This is our deltoid muscle. Okay, and then we will draw also step by step. Can you see, this is our deltoid muscle. So start our three-dimensional orientation, very interesting part. So just observe this one. Okay, yes, this is our scapular region near the scapula. Yes sir, this is responsible for rounded contour of the shoulder. Just touch. So clinical point, what you have to remember, if there is paralysis of this muscle, that will cause loss of rounded contour of shoulder. Yes sir, if there is a paralysis of the muscle, then the loss of, there will be no proper rounded contour of shoulder will persist. Fine sir. Now try to understand, this deltoid muscle is having three types of the fiber. You are looking from the above. Are you getting the point? You are looking from the above. This is our upper limb. Yes sir, we are visualizing this our deltoid muscle from the above. So clavicle side is anterior fiber, this one is anterior fiber. Towards the spine of scapula, this is posterior fiber. and this is our acromion process. Can you observe? Yes, this point is the acromion process. Lateral border is related with our middle fiber. Actually, you have seen this all the points during osteology, but separate part. Right now in this video, we are concentrating all the muscles together. Okay, sir. Try to understand all the anterior fiber, middle fiber, and the posterior fiber. They all are converging together and coming in the humerus. In the humerus, there is the one V-shaped rough area on the lateral side of the shaft. That point was known as deltoid tuberosity. Only one point for the insertion you have to remember. This is our deltoid tuberosity. Action. See here, anterior fiber is coming from the front and inserting in this way. So when this anterior fiber will contract, it will carry our arm front. It will pull the arm front. This movement is flexion, decrease in the angle of the joint, flexion. When the anterior fiber will contract, it will help in medial rotation of the arm. Can you see? Medial rotation of the arm. In the same way, when the posterior fiber, it is contracting, so it will carry the arm backside. It will carry our arm towards the lateral side. So this is our extension and lateral rotation of the arm by the posterior fiber. Middle fibers, they are taking origin from the acromion process, lateral border, and inserting at the our V-shaped deltoid tuberosity. So when they will contract, they will cause what? They will cause, they will do abduction. They will cause abduction of the our arm. The middle fiber is very important, causing the abduction. Nerve supply, I told you, that is so simple. So we are going to make the diagrammatic presentation. Okay. Here. What are the different origin, insertion, these things? This is the your review. So this is our anterior fiber. Okay, sir. Anterior fiber of deltoid. Here you can see the posterior fiber, and here you can observe middle fiber. Getting the point? Anterior fiber, you can see it is taking origin from our clavicle. The posterior fiber, it is taking origin from the our, can you see this point? That is our lower lip of spine. And the middle fiber, this is taking origin from this particular point. Can you see? These all are the points from where the muscle fibers are taking origin. Yes, sir. This is our lateral border of acromion process. And if you remember, I just want to recall you one point, that trapezius insertion is just opposite to this all the structure. Trapezius upper fibers, they are taking insertion along the lateral border of the clavicle, upper fiber. Middle fibers, they are taking insertion along the medial border of the acromion process, and the lower fibers, they were taking insertion at the upper lip of the spine of scapula. Just see here, these are the points. For the insertion. Getting the point? So this is our muscle. Which muscle? This is our trapezius. Yes sir, this is our trapezius. Getting the point, beta? Fine. Here is the insertion. Okay, so just look at this diagrammatic presentation again. Suppose this is the clavicle. Diagrammatic presentation. Okay. Okay sir, this is our clavicle, medial 2/3, lateral 1/3 of the clavicle, and it is articulating with the our acromion process. This is our acromion process, suppose, and then this acromion process is continuing as the our spine of scapula. Okay sir, what I told you, this is our clavicle, here is the spine, and this is our acromion process. Fine sir, you are looking from the lateral side, you are looking, this is our shoulder, you are looking from the lateral side. Fine sir. Now see, there is our humerus shaft, we are not drawing, we are just drawing the our deltoid tuberosity. So this is our deltoid tuberosity, V-shaped rough area on the shaft of the our humerus on the lateral side. Okay sir, now try to understand. Yes, first we are drawing the our important point. See here, one by one, anterior fibers are coming from the anterior side. Okay sir, they are taking origin from the lateral 1/3 of the clavicle. Yes, where? Anterior border. And in the same way, the our posterior fibers, they are taking origin from the spine of scapula. Yes sir, from the our which lip? Lower lip. Okay sir, fine. Now we are talking about our acromion process. So acromion process, see here little more detail. Okay, so in this acromion process part, you will observe there are intermuscular septum. Yes sir, there are our intermuscular septum. For intermuscular septum, they are attached along the lateral border of the acromion process. Okay sir, and there are the different intermuscular septum which are attached to the our deltoid tuberosity. So this is, can you remember, can you recall with your general anatomy part? Okay, there is the fiber arrangement, when the fibers are arranged only at one direction, that is unipennate. When they are arranged on the both the direction, bipennate. When these muscle fibers are arranged, okay, with the multiple feather like appearance, then multipennate. So just observe here, just try to observe the middle fibers, they are showing the arrangement. Yes sir, like the multi feather appearance. Just to recall the general anatomy. Okay, we have described this all the things, unipennate, bipennate, multipennate arrangement. Fine sir, so can you see this all the part? Okay, that is our middle fiber which is multipennate, and that green color structure is showing the our, yes, intermuscular septa. So draw the diagram step by step so that you can retain the facts for the your long term memory. Getting the point? Yes sir. Here is your deltoid tuberosity. Okay, so what we have to mention here, these are our anterior fibers. Here is our, yes, posterior fibers, and these are our middle fibers. Okay sir, you can see the very important MCQ, middle fibers, they are multi pennate in arrangement. MCQ, how can you remember? M for middle fiber, M for multi pennate. Getting the point? Okay, and this green color structure, actually these are our, you can say, intermuscular septum of origin. Okay, and this insertion is our deltoid tuberosity. MCQ, this deltoid tuberosity is insertion, important. Okay, so these all are our different things. So you can mention our origin. Yes sir. First, anterior fiber. Yes sir, the anterior fiber, it is taking origin from clavicle. Good, complete answer. Anterior border of lateral 1/3 of what? Clavicle. Next, what you can say? Middle fiber. Middle fiber is taking origin from the lateral border of what? Acromion process. Okay sir, and remember these are having the various intermuscular septa of the origin. Fine sir. Now third, posterior fiber. The posterior fiber, they are taking origin from lower lip of spine, definitely of scapula. Okay, definitely insertion only one line, that is our deltoid tuberosity. Nerve supply, no excuse. Axillary nerve. MCQ, this axillary nerve supplies the two different muscles, only two muscles. First is our deltoid, another is muscle teres minor. So this is another very important MCQ, that axillary nerve supplies which two muscle, and it is also asked what is the root value. We have learnt many times, अब तक 56 नाना पार्टिकल, little contribution from the our C7 spine, C7 also, C7 root. Okay sir, now I told you, I described you about the action. So anterior fiber, anteriorly it will cause flexion and medial rotation. So definitely it is causing the flexion and second medial rotation. Remember, these all are done at only one joint, that is our shoulder joint. Then posterior fiber, they are responsible for the our extension and yes, lateral rotation. And then middle fiber, these middle fiber are multi-pennate. Remember, these are very important question, multi-pennate. And in general in art, I taught you multi-pennate arrangement, it gives excessive strength. So remember, it is responsible for the elevation of the our arm. So remember, this arm is very heavy, you know, 2.5 किलो का हाथ, हाथ का वजन कितना होता है? 2.5 किलो का. यस, यू नो सनी देओल. ओके, तो 2.5 किलो के हाथ को कौन उठाता है? सनी देओल? नो. 2.5 किलो के हाथ को रिमेंबर our deltoid muscle is elevating. कहाँ से कहाँ तक? 0 to 90 degree according to the recent concept. Okay, so what is action? Abduction of the arm from 0 degree to 90 degree. This is better answer. पुरानी बुक्स कहेंगी बेटा 15 degree to 90 degree, but go with this recent edition update. Okay, so these all are the our action. Fine, these are the different points which you have to remember. Okay, so this is all about the today's class. We will continue this part tomorrow also. Okay, so thank you very much. God bless you all. Take care.